see this scenario. This is a pan of boiling water. What do you think this is? Is this a hazard or is this a risk? So, a pan of boiling water in the kitchen is actually a hazard, right? And now what happens now if you have a small child coming in the kitchen on pan of boiling water? Then it becomes a risk, isn't it? Now it becomes a risk. Now see another photograph. Now what have you done? You have put a gate on the kitchen door so that the child cannot enter the kitchen door. What is this? This is risk mitigate. You have assessed the risk now that, okay, there is a pan of boiling water. It was just there in the kitchen, nobody in the kitchen, nothing happens. If a small child comes and tries to hang on the pan, probably the boiling water will spin on him. Then it becomes risk. You have assessed the risk that, okay, this is a major risk for a child, and what you have done is mitigation. You put a gate in the kitchen door, and this is called risk mitigation. And exactly this principle applies in our laboratories also. Now another example is, this is, see, a man is watching from, you've seen Australian news now, people who are watching from a distance, from a beach, they're watching the sea, and you see the shark. What is it? Is hazard or risk? That is hazard. Now, if a person tries to jump in and tries to swim, then it becomes a risk. And mitigation would be that you make them aware that you don't have to do this when you know that this part of the sea would have sharks. So awareness messages out there would be risk mitigation. Now, same principle, what is biohazard? Now, if you apply to science, hazard due to biological material that we handle in the laboratory is called the biohazard. And biohazard materials could be anything. It could be microorganisms that you have grown, infectious substances. For example, all the samples that you are handling, because they have all the biohazard material. Any natural reoccurring, bioengineered or synthetic components of any such microorganism or infectious agent, substances capable of causing death, disease, or any other biological malfunction to humans, animals, plant, or any living organism would be a biohazard. It could be deterioration of food, water, equipment, supplies, or anything, harmful alteration of the environment. All this becomes a biohazard. Is that clear? Then what is this? This is a biohazard sign that all of us should know. When we see this sign, we should be alarmed. This is a symbol that universally recognized as a warning against infectious substance that can pose a threat to human health, right? And this biohazard symbol was developed by Charles Baldwin in 1966. He was a chemical engineer, and he had this idea that whenever we are transporting these samples, we should give the indication that these are hazardous. And so all the biohazard material has to be labeled by this sample. This is bright orange in color so that it catches your attention. And he said we wanted something that is memorable but meaningless. And whatever side you turn, it will just remain the same. It is meaningless, but it creates a lot of meaning, right? So this is universally recognized, communicates potential exposure. Some other symbols are that this is the symbol of toxic or poison, that we should be putting it on such substances. Next symbol is that of corrosive, and suppose you are handling acids like we do in mycobacterial lab, sulfuric acid or hydrochloric acid, you should put the corrosive symbol there. This is a symbol of explosives. So whenever we have explosives or flammable substances, we should be familiar with these symbols and we should use them. Before I proceed further, I want to talk about pathogenicity or virulence of the organism very, very briefly, because entire biosafety principle is based on pathogenicity or virulence of the organism. So what is pathogenicity or virulence? It is an ability of a biohazardous material to produce or develop a disease. Highly pathogenic may produce disease in healthy adults, but other mild organisms may not produce disease in healthy adults. Opportunistic pathogens will infect only hosts with lowered immunity or sites other than their normal habitat. And some biohazardous materials are attenuated. What do you mean by attenuated? That is weakened. We have reduced by repeated passages or by removing the virulence genes, we have reduced its virulence. And then they do not produce significant disease, but they can multiply in body. Can you think of an example of such material? I'm sure you've thought of vaccines where we have attenuated the microorganism in a way that it multiplies but does not produce significant disease, however, produces antibodies which will be protective. The more severe the potentially acquired disease, the higher the risks. Why I have told you this is that the entire biosafety principle, whereas levels of biosafety principles are based on pathogenesis and this. Now, what is risk? Biorisk. Biorisk is associated with biological materials. We have just understood that, and it encompasses biosafety and biosecurity. Now, can you differentiate between biosafety and biosecurity? Think of what is biosafety. So, biosafety, as we've said, is saving ourselves, human beings, from dangerous organisms or dangerous infectious material. On the other hand, biosecurity is saving these pathogens from dangerous people, people who will misuse those organisms. So you have to secure these organisms in a way that they don't fall in dangerous hands. You must have heard about the biological warfares. That is, even these simple organisms can be converted into bioweapons. So you have to secure them so that you protect these organisms from dangerous people. Biosafety is protecting ourselves from the dangerous pathogens. So coming to the definition, so biosafety is to protect us from harmful incidents or potentially harmful biological agents, whereas biosecurity is institutional and personal security measures designed to secure pathogens, toxins, and sensitive technologies from unauthorized access, loss, theft, misuse, diversion, or intentional release. Is that clear? So one is biosafety, another one is biosecurity. Coming to principles of biosafety and good laboratory practices. So this concept of biosafety was formally introduced in 1984, and it has two fundamental principles. One is containment, that is, you restrict, containment is restricting these microorganisms in a place. And second is the risk assessment, that you assess the risk. So we will discuss both these. So containment is combination of good microbiological practices, safety equipment, and facility safeguards. So three things: that you have to have good microbiological practices, you should use safety equipment, and facility safeguard, that is the institutional mechanism, the third layer, to protect the laboratory personnel as well as the environment and public from exposure to potentially hazardous agents. And what is risk assessment? Risk assessment enables us to select appropriate safety measures by evaluating the hazards. And how do you evaluate the hazards? We learned about the virulence or pathogenicity of the microorganisms. You know, And also, so microorganism, biological agents are one thing, and then lab procedures. Maybe you're doing lab procedures which generate aerosols, which, even the uh, pathogens which are not of high virulence, but if you are not handling them properly, they may cause disease. Can you think of an organism like, or procedure like this where you can cause disease due to aerosolization? I'm sure you thought of centrifugation. If you don't do centrifugation properly, if you do centrifugation in open centrifuges, you are going to generate a lot of aerosols in the laboratory, which could be biohazardous. Is that clear? So principle of biosafety, as I said, is containment and risk assessment. And now containment, as I told you, is divided into primary barriers, which is safety equipment, personal protective equipment, secondary barriers, that is facility design and construction. Then comes, so facility design and construction means various biosafety level laboratories, which we will discuss in detail. Facility practices and procedures, like I just described, various procedures that we follow in the laboratory. And of course, various biosafety levels of the laboratory we'll discuss in subsequent slides. So what is the purpose of containment? Why should we contain? It is to reduce the risk of exposure to the staff and prevent unintentional release of hazardous biological agents and toxins into surrounding or community environment. Please remember that protecting self is very, very important. Equally important are protecting the environment and public. So biosafety encompasses all three things. You have to protect self, you have to protect others around you, you have to protect the environment and also public who's coming to the hospital. So comprehensive biorisk assessment is key component of successful biosafety program. Now, how do we do biorisk assessment? We will come to in subsequent slides. Final determination of the combination of containment measures should be based on the biorisk assessment, right? How do you assess the risk? I will tell you in very scientific way, but this risk assessment has to be done at your own level. Why? Because any risk assessment, suppose now I'm sitting in my laboratory, I know that I have kept my freezer is here, my centrifuge is here, my samples are received at this place. So how do I manipulate these three things so that there is no spill? Only person who is working in the laboratory will be able to do it. So you should understand the principle of risk assessment, and individual has to do risk assessment to protect self, environment, and others around. Okay. So containment, as I said, safety equipment, personal, we'll discuss all these things as we go along. So coming to primary barriers, which are first line of defense, placed directly at the level of hazard. And these include containment devices like biosafety cabinets and enclosed containers for protection. Now, what are biosafety cabinets? These are class 1, 2, and 3 biosafety cabinets. Now, biosafety cabinet, usually class 2 is most commonly used in our laboratory, and after the NMC guidelines, biosafety cabinets are almost must in the microbiology laboratory. Now, these biosafety cabinets are classified further, which we will see in subsequent slide, but class 2 biosafety cabinet, where 70% of the air is recirculated and 30% air is exhausted out. It is a laminar flow of air through HEPA filters, and such cabinets will protect. If you are working properly in the cabinets, you can protect yourself and you can protect the environment, as well as you can the organism or the product that you're handling inside the biosafety cabinet is also protected, right? Biosafety cabinet 3, here is an enclosed cabinet which is sealed, and you can work in these sealed cabinets. So generally we are using class 2 biosafety cabinet. They are further classified. I will come to those. And the class 1 cabinet is simple laminar flow cabinet, where you can handle sterile equipment because it will not provide protection to the to self and the product, whereas it can provide protection to the environment. Then centrifuges, sealed rotors we have to use. So these are the first line of the defense. Now coming to personal protective equipment, which is very, very important. And this is a protective layer between personal and potential hazards. These include gloves, lab coats, gowns, closed-toe footwear, shoe covers, respirators, goggles, face shields, and earplugs. And these have to be used alongside the containment control like biosafety cabinets and safety cups. Now, you would have heard this personal protective equipment includes everything: gloves individually, lab coats, gowns, and shoe covers, respirators, everything to individually is called a personal protective equipment. And during the pandemic or even before in outbreak situations, we make a kit out of it. So it is called personal protective equipment kit, which includes everything. It is only for convenience. So if people say PPE, don't, I mean, you have to clarify to them that each is a personal protective equipment. So this confusion occurs, and microbiologists sometimes are required to clear this, right? And how do you select PPE? That is again based on risk assessment. Now, here the risk assessment would be again coming to pathogenicity and virulence. How does the microorganism spread? Now, if it is a respiratory spread, then you should use masks. Your mask should be highly specialized. So you have to use N95 mask, or you can use a triple layer mask depending upon the pathogenicity and virulence of the organism. Now, what is a triple layer mask? Triple layer mask is a medical or a surgical mask which you put it, you identify the clip of the on one side of the mask, put it on your nose, press it, and then you tie the mask with the strings. Spread it open completely so that the secretions do not accumulate there. And what is the N95 mask? So N95 mask is shown here. It filters out about, it has efficiency of 95% of filtration, right? And it is sealed. So it fits in your face properly. And when you do a fit test, if you breathe inside, there will be, the mask will get sucked in, right? Because you are breathing filtered air. So you have filters in it. So that is the difference between the surgical mask and the N95 mask. Now, actually, the efficiency of both are almost equal, and the triple layer mask has three layers. The inside layer is it absorbing layer, that is hydroscopic, which will absorb your secretions, and outside layer is hydrophobic layer. Hydrophilic and hydrophobic is that it will dispel the particles, and inside the third layer between these two layers is a sheet of filter which will filter the pathogens. So use of mask, so if you are using, if there is a chance of respiratory transmission, you will use N95 mask. Otherwise, you can use the uh, triple layer mask, which if used properly, it protects. Similarly, lab coats or gowns. I'll talk about gowns. Now, gowns can be reinforced gowns or non-reinforced gowns. So you have to assess whether what you need. So if you need a waterproof environment, like if the transmission of the organism is through contact, close contact, then you need a waterproof gown. But if the transmission of the organism is respiratory route, then you need not use a reinforced gown. You can use a simple gown. Closed-toe shoes, footwear are almost mandatory in the laboratory. However, gumboots, etc., are used by people who are handling our waste. So, what I want to emphasize is that all these PPE should be used based on the risk assessment. Closed goggles are required when you suspect a contact transmission. And face shields can be used when you are using procedures which will cause splashes, right? So this is how we do a risk assessment and select our PPE. So next is coming to facility design. Before that, I'll tell you about the what are the other methods of biosecurity and biosafety is controlled access zones that restrict entry to the unauthorized persons. Then other facility design is that you should have airlocks in the laboratories. There should be anti-rooms where you can change your PP, HEPA filters. Depending on the risk assessment, these things are needed in the laboratory, and I will tell you which laboratory at what level has these facilities. Then the proper ventilation, directional airflow is also a requirement when you are handling certain type of pathogens, especially in biosafety 3. Effluent decontamination system to treat waste safely is also a requirement in BS, especially for biosafety level 3 and 4 laboratories. So, facility specific best practices and procedures are important for biosafety. Most important is trained personnel and proficiency in necessary safe and practices and procedures. So, training following SOPs forms a very, very important part. If you have an SOP for certain things, please follow it to the hilt. The SOPs are designed by experienced people so that person should be able to identify potential hazards and be properly trained in safe laboratory techniques. One has to adhere to written standard operating procedures and best practices and participate in regular biosafety training based on their duties and exposure risk. Now, this biosafety and biosecurity topic is incomplete without, practical training. An entire biosafety, biosecurity training is about 2.5 days training where we give hands-on experience. So this time in Microcon, IAM graciously gave us the opportunity to conduct one of these trainings where we combine these lecture topics as well as some practical training like working in biosafety hood, donning and doffing of PPE, how to handle your centrifuges and safety, the pipettes, etc. We gave them a practical demonstration. We showed them the biosafety, various biosafety cabinets. So it is, these things you will understand better when you go to the lab. Keep these things in your mind and experience what we are saying right now. And if you get an opportunity to work in a in by participate in biosafety biosecurity training program, please do it, because this will be your lifetime experience where you will carry these things throughout your life when you are practicing microbiology. Coming to various biosafety levels, and how are these biosafety levels 1, 2, biosafety level 3 and 4 decided? So 1974, CDC published classification of ecological agents based on the hazard they cause. And this report introduced the concept of establishing ascending levels of containment, which correspond to risk associated with handling infectious microorganisms based on their hazardous characteristics. So, even the human pathogens have been grouped into 4 classes according to how they get transmitted and what is the severity of disease they produced and whether the treatment is available for these diseases or not. So, these are the considerations which CDC took and released this. So, risk group 1 is no risk or low risk individual to self and to the community. So these microorganisms which are grouped in risk 1 are unlikely to cause human or animal disease. Can you think of an example for this? It is a non-pathogenic E. coli or your microflora of the oral cavity. There is microflora on skin. These organisms do not cause any disease. So these are risk group 1. Coming to risk group 2, and where are these organisms handled? These are handled in when you do your class 2 buccal smear. You know, those are risk group 1 pathogens that you handle. So any teaching school laboratory will usually handle risk group 1 pathogens. And so they don't use a lot of, they don't have those primary and secondary barriers because they are using only their own or microorganisms which usually do not cause any disease. Coming to risk group 2 pathogens, which are cause moderate individual risk, but no or low community risk. And these pathogens can cause harm to humans or animals, but they are not a serious hazard to lab workers or community. They can cause serious infections, but effective treatment and preventive measures are available, and risk of spread is very limited. Now, these are the common pathogens that we encounter, like the organism and family Enterobacteriaceae, like E. coli, Klebsiella, etc., Candida, Mycobacterium avium complex, herpes simplex virus, measles virus, salmonella species. These are the organisms which can cause disease. However, we know the treatment, we know how to prevent them, and so they constitute risk group 2. Risk group 3 organisms have high individual risk but low community risk, and these pathogens usually cause a serious human or animal disease, but effective treatment and preventive measures are available, like your West Nile fever, yellow fever, Mycobacterium tuberculosis, Yersinia. We know the treatment, right? We know how to prevent it. For example, yellow fever vaccine is available. For others, the treatments are well defined. So these are risk group 3. But they cause serious infections, of course. Risk group 4 are high individual risk, high community risk, and they cause serious infection. They can get transmitted very quickly from one individual to another, and effective treatment or preventive measures are usually not available. So these are the highest risk, and they are risk group 4, like Ebola virus, Crimean Congo hemorrhagic fever, smallpox, Lassa fever, etc. Now, based on this risk, similarly, the biosafety levels of the laboratory have been defined, 4 levels, and these are determined based on infectivity, severity of disease they cause, transmissibility, and nature of work that is going to be conducted. Each biosafety level has its own specific containment controls. Those can be laboratory practices, the safety equipment that you are going to use in the laboratory, and the construction. So these are the 3 dimensions of BSL 1, 2, 3, and 4. And each biosafety level builds on the controls of level before it. So some things are available in biosafety level 1. On top of that, some things are added in 2. And on top of that, some things are added in 2 to make it 3, like that. So they are, additions over level before them. Every microbiology laboratory, regardless of level, should have standard microbiological practices. Now, this is a standard. Most lab accidents, most spread from lab, are caused due to human error. You may have a fantastic laboratory, but you may be working in BSL-4 facility, but if you don't know how to work in BSL-4 facility, you will infect yourself, as well as there will be danger of spread. So standard microbiological practice, a critical thinking hat, is very, very important when we talk of biosafety and biosecurity. So biosafety level are organisms that are not known to cause disease, as we have discussed, and these practices where you have to use standard microbiological practices, and work can be performed on open benches and tables. And I told you that these are the laboratories which are usually present in the school, and they will have a sink, they will have a sharp hazard warning policy that you may use a personal protective equipment like a lab coat. There will be a lab bench where you work, and there may be an autoclave, or may not be an autoclave. So those are biosafety level 1. Biosafety level 2 laboratories, which are all medical colleges laboratories, they are suitable for work with agents associated with human disease and pose moderate hazard to personal and the environment. And risk group 2, which we have already discussed, organisms are dealt in biosafety level 2. Now, if we compare biosafety level 2 to 1, lab personnel receive specific training in handling pathogenic agents while working in biosafety level 2 laboratories with risk group 2 pathogens. And access to laboratory is restricted when work is being conducted. Even in medical colleges laboratory, we should be careful that no outsiders walk in. And procedures in which infectious aerosols or splashes may be created are dealt in biosafety cabinets. So biosafety level laboratory, I told you, in addition to all that, also you have to use a proper personal protective equipment. There will be lab bench, there will be an autoclave, and access to the lab will be restricted. All procedures should be performed in biosafety cabinet, usually class 2, and autoclave or alternative decontamination methods should be available. BSL-3 laboratory are suitable for work with exotic agents or agents which have serious or potentially lethal disease they can cause, but we know their treatment. So risk group 3 pathogens, and here in addition to that, you have a powered air purifying respirator you may use if you are working for a long time. The laboratory is a sealed laboratory and it has exhaust with HEPA filter, and all the effluent, all the lab waste that comes out should be decontaminated before it comes out of the environment. The area is double door restricted, which means when one door opens, you have to close. If you open the first door, unless you close the first door, you cannot open the second door. There should be a hand washing facility inside, and PPE can be in these laboratories can be worn as per the risk assessment. Coming to biosafety level 4, these are handling dangerous or exotic agents, and they pose high individual risk, especially aerosol transmitted diseases, life threatening diseases which for which treatment is not known. That is the risk group 4. And here, you have to have a highly specialized personal protective equipment, and the air is pumped inside the PPE so that you can breathe and work This is completely sealed laboratory. And do you know how many biosafety levels do we have? Think about it. I told you all medical colleges should have biosafety level 2 laboratories, which means they are there in every medical college, or every medical college is proposing to have biosafety level 2 laboratories. Biosafety 3 level laboratories, you think we have biosafety 3 level laboratories in India? Yes, you're thinking right. We have around 35 laboratories and it is being upscaled to have more than 200 laboratories throughout the country. How many biosafety level 4 laboratories are there in India? Any idea? So biosafety level 4 laboratory, as of now, we have only one biosafety level functional laboratory, BSL4 laboratory, that is National Institute of Virology, Pune. Before this, there was another laboratory in Bhopal, which is Nishad Bhopal, National Institute of, it is a National High Security Institute of Animal Health. So that was earlier biosafety level 4, but they did not meet certain requirements, and it is now level 2 biosafety 3 plus laboratory. But that was our first biosafety level 4 laboratory in animal sector. Why I brought this now is that, when it comes to dangerous pathogens, most of them are zoonotic in nature. And for zoonosis, we have to work in coordination. And here I'll introduce another terminology that which is commonly used is One Health approach to diseases. So for certain organisms, we will have to use this One Health approach and we do both animal and human samples judiciously after assessing the risk in these laboratories. When HSADL Bhopal, that is the veterinary laboratory, we used to do all samples there. Subsequently, National Institute of Virology Pune has developed, it is a state of the art laboratory. This also handles both. National Institute of Virology is in it's an ICMR, DHR ICMR laboratory institute, but it handles both human and animal samples. So as the threat increases and level it, because these laboratories take lot of cost for maintenance of laboratories. So we have to share the resources and work judiciously in these laboratories. Now, this table summarizes whatever we have discussed, on biosafety level 1, 2, and 3, 4, based on isolation, your room sealable or not. So 3 and 4 are sealable. Ventilation system. So controlled air is desirable in 2, but it is definitely there in 3 and 4. Similarly, double door entry, which I've explained in 2 or 3, in 3 and 4. Airlock with shower, 3 and 4. Effluent treatment, definitely in 4, desirable in 3. Autoclave, desirable in all except 1, but most certainly in 4. And biological safety cabinets, desirable in 2, 3, and 4, of course, it is required. And anteroom for shower, again, it is must in biosafety level 3. And of course, you have various other levels of safety of having eye wash stations, complete shower in case of accidents. So this was about biosafety levels. Now coming to good microbiological lab practices, which is in our hands. And this is the most critical component of biosafety and risk management in the laboratory. Even the most advanced and well-designed laboratories are only safe when competence of its workers is adequate, right? So we've noticed that most incidents arise from human errors. If you're wearing PPE and not wearing PPE properly, or you're wearing it incompletely, or you don't know how to doff PPE, you don't know how to handle sharps, then the accidents are more liable to occur. Therefore, training is very, very important. And these are practical aspects as to donning and doffing of PPE. You should know how to wear a glove. You should know how to wear a mask. You have to cup the mask, put it on your nose, then put the strings. Which string first, which string second in N95, and uh, uh, in surgical mask. Try doing it so that they don't fall on your this thing. So you have to try the upper string first when you're donning PPE. So donning means wearing PPE, doffing means taking off PPE. So these are scientific methods of doing things which practically you should do, right? And good microbiological lab practices are standardized operating procedures, behaviors, and technical practices that apply to all microbiology activities involving biological agents. And they are universally implemented regardless of safety level. And they include general biosafety instructions to lab workers, which we are doing right now, laboratory safety, and standard precautions. So you should have a safety manual in the lab. We have designed a safety manual, and it was on the website. However, we because of change in website, our ABBIMS and RMLH, it is no more there, but in a week or 10 days time, you will see our biosafety manual again on the website. Eating, drinking and smoking should be prohibited. Closed shoes, I've said. Now, avoid wearing lenses. Instead, use spectacles. Use appropriate PPE as per assessment. Long hair should be tied properly. Clean and dirty areas should be demarcated so that you can risk assess these zones and wear PPE accordingly. Work surfaces in daily use must be disinfected with 0.5% sodium hypochlorite. So after you finish the work in biosafety cabinet, it is your responsibility that you clean it properly, right? And uh, it is, don't wait, just don't leave it and go thinking that, oh, technical staff will come and do or safai karamchari will come and do. So cleaning the work surfaces where you're working is your responsibility after you finish the work. Decontaminate hazardous material, that is now biomedical waste management, also comes in biosafety, but I've not touched upon it seriously because it's a separate topic itself, and I'm sure Dr. Sonal will take it up separately. So segregation of waste at source is extremely important, and laboratory work surface should be decontaminated immediately after spill. Suppose there has been accident, then you should be able to manage the spill, and for that every lab should have a spill kit, which should have biohazard bag, sterile gloves, a single use heavy duty gloves, face mask, disposable gown, paper towels, hypochlorite solution. This should be freshly prepared. Now, hypochlorite is one disinfectant which should be freshly prepared every day. So, when you are dealing with high risk pathogens, your hypochlorite solution should be prepared and kept ready always for discarding as well as for spill management. And it should have cleanup scoop and scraper. So, this is also an exercise we do when we do this training. So if there has been a spill, you have to shout out so that nobody comes there because you have spilled a biological material. Put absorbent towels on that, and then or tissue paper, and then put 1% sodium hypochlorite solution. Give the contact time of 20 to 30 minutes for it to act completely and disinfect this thing, and then you have to properly pick up with the scrapers all the material and discard it in the yellow bag. Subsequent to that, a regular cleaning should be done. So first, which I forgot, was that you have to put on your PPE and then properly take off the PPE after that and report this incident in the incident reporting form. What is its importance? We will come to it subsequently. Other laboratory practices is that you have to have a biohazard symbol in entry of the laboratory. Door should always be kept closed. Don't scatter the laboratory. You should have enough space, regular water supply, ample illumination, first aid box. You should be trained in dealing with fire and electricity emergency and safety tips. There should be an emergency shower in case you spill something on yourself, an eye wash facility, and emergency electricity supply in case something happens. So you should have battery operated lights in the lab just in case there is a major breakdown. Right? Now, the standard precautions include personal protective equipment, have hand hygiene, and safe techniques. We have spoken about personal protective equipment based on the risk assessment, what PPE to wear, and various steps of donning and doffing. I think I'm running short of time, so I will skip this, but it's given everywhere how to wear PPE, what are the steps to wear PPE, and always wear PPE in front of the mirror or what is called the buddy system, right? So that people can check. Now, wearing PPE is very important because you have to do it in a procedure that your body parts are completely covered. Equally important is taking off PPE because now, after working in the lab, you have probably your PPE is contaminated from outside. So you roll your PPE inside out and then take it off. Okay, coming to hand hygiene. So when your hands are visibly soiled or dirty, you use soap and water, and it takes 40 to 60 seconds. And hand rubbing is preferred with a solution, alcohol based preparation, and it takes about 20 to 30 seconds. So, what are the steps of hand hygiene? Do you know the steps of hand hygiene? Because that should get inculcated in your system now. And I will give you a mnemonic so that you can practice hand hygiene, and please practice. Okay. So, first is that you rub your palms properly. both the palms properly with interdigital space. Then on the back side of the palm and interdigital space, right? And then you have to do your knuckles on both the hands properly. Then the thumb on of both the hands, then the fingers tips rubbing against the palm of both the hands, and then you wash with water, running water, and then you dry. Now, drying is very important, okay? Uh, and then you dry, either you dry with tissue towel or you can do it with a clean cloth, both ways. So these are the steps of hand. How to remember these steps? The mnemonic is that you have to remember a name called Suman. And if you're Hindi speaking, you will understand Sa se Seedha, that is you're rubbing your palm. U se Ulta, on the other side. M se Mutti, that is your knuckles. A se Angutha, that is your thumb. N se Nakhun, that is your nails. So these are the steps of hand, and each step for about 5 to 10 seconds if you're doing with soap and water, and then wash it and dry your palms. I hope you will remember this and try practicing it every time when you're doing hand washing, right? Then other safety techniques like mouth pipetting should be avoided. Centrifugation should be done enclosed. You should know how to work in a biosafety cabinet. That is, on one side, if you are a right-handed person, left-handed side is a clean area and right-handed side would be a contaminated area. In between is a working area. Your front gauge of the biosafety cabinet should never be covered so that you don't hinder the flow of the biosafety cabinet. So I have a video here, but paucity of time, I'm not going to play it. You can see the video or you can come to our lab to see these techniques. Similarly, sharp handling should be done carefully. Never recap the needle and discard it in a puncture-proof container. I'm sure you are already doing, you've seen this puncture-proof container where you discard the needle and this container is never opened, right? Then when you are handling the samples, these containers should be usually should be tightly sealing containers. They should be break and leak proof. The sample should be clearly labeled, and secondary leak proof containers uh, cover the primary leak proof containers. They should be kept in upright position during transport, and there should be designated receiving area. And this type of thing to put the samples on the forms should be strictly avoided. So why sample packaging and transport is important? Because these samples are biohazard. So safety, timely reaching of samples, efficient samples, and legality are involved. And of course, we have to protect the shipper, the carrier, the environment, and the receiver. And there should be no contamination of the environment, human or animals, and we have to comply with national and international regulations. And we follow IATA guidelines, the international guidelines for transportation of samples, where we classify the samples. I'll tell you how they do it. Pack it properly, label it properly, mark it properly, document, and there is a special training for this. So the dangerous goods are classified as 1 to 9. 1 is explosive, 2 is gases, flammable liquids, solids, oxidizing substances, and organic peroxides. And the infectious substances and toxic substances are class 6, which pertains to us. And 6.2 is the infectious substance, the material that we handle. Radioactive material is class 7, corrosive 8, and miscellaneous and dangerous good. So 6.2 pertains to us, and it includes category A, infectious substances, and category B, infectious substances. I will come to it, tell you what is category A and what is category B. So the basic triple layer packaging is primary receptacle where you put the sample in, and this should be airtight, leak-proof container. And secondary packaging is one where the primary container goes in, and the tertiary is the triple layer packaging. So primary container, watertight, leak-proof, screw-capped vials kept in upright position. Secondary container should be durable, watertight, and leak-proof to enclose and protect the primary container. And the outer container should be made of strong material to protect both secondary and primary container. Should have a biohazard label and content list sealed in the plastic bag. Now, this is the triple packaging. So, primary container is a primary receptacle which has the sample, right? And it is surrounded by the absorbent material. Just in case it breaks, the biohazard material should be absorbed here. This is put in secondary container, and then this is the tertiary container. And this is the requirement of the international regulation. So the outer container should have shipper's name, receiver's name, emergency contact number, proper shipping number, UN number, and biological substance label. So it should have a biohazard sign, orientation sign. If you are using dry ice, you have to put a dry ice sign, and cargo airlift only. So that it should also be put, and that is how it looks once we have packed the things. Now, this is, as I told you, we follow International Air Transport Association guidelines, and uh, uh, you know, only then transport the samples. Now, there are certain UN numbers that we have to give to infectious substances A and B. That depends on whether the samples are samples which cause disease only to humans or cause disease to humans and animals together. So UN numbers have to be written, and they are given everywhere. Now, how to improve daily biosafety level? That is, you do a risk assessment and analysis of incidents. So risk assessment, we've already discussed how to do a risk assessment, just couple more slides. And analysis of incidents is very important to avoid future bigger accidents. Even if it is a small incident, one should report. Why one should report is not because you are complaining, but because you are trying to improve. Once you document it, then certainly you will not repeat it the next time, or you will prevent a bigger accident, right? So risk assessment, as I told you, it's a core principle of biosafety. They are analytic process to identify hazard associated with infectious agents or toxins, and what we evaluate, what is the likelihood of exposure, and what are the consequences. So you're doing the likelihood of exposure and consequences of exposure together, and the findings then guide the selection of appropriate containment level. So risk is equal to hazard into exposure. When do you conduct the assessment? Before beginning the work with infectious agents. When introducing any new procedure or new equipment, do the risk assessment. When you are modifying workflow in your laboratory, suppose you have shifted your fridge from one corner of the lab to another, you must do your risk assessment. Now, what could be the hindrance in taking out specimen or kits from this fridge and coming to the biosafety level? So you should do that. You should record any incident or near miss incidents also, where you were about to trip but you didn't trip. So those incidents are also should be recorded, and this is how we improve the quality of the risk assessment. And hazard evaluation is done by looking at various agent hazards like bloodborne pathogens, airborne pathogens, zoonotic pathogens, and when you're dealing with unknown agents. So you have to decide whenever you're producing invisible aerosols, you have to be more conservative in your approach. Agent hazard is the biological hazard we've spoken about. Procedural hazards we've spoken about, when you're performing a procedure, whether you're pipetting or centrifuging or vortexing. Personal hazards are human errors when you're not wearing your PPE properly, or you chose wrong PPE, or because you were overworked, you did some shortcuts. And facility and environmental hazards are infrastructural hazards that you are not working in biosafety level 2 laboratory because you don't have it. So you have to identify these hazards and accordingly do the risk mitigation, which we have discussed, that you have to use an appropriate PPE, You have to identify physical barriers and you have to follow all the policies, which means your administration should also be sensitized so that they give you a proper place. And most important is training and then tracking the performance and doing the improvement. So it really matters because uh, your performance, you may be trained, but if you're not performing efficiently, there will be near misses and there will be accidents. So this summarizes the management risk management systems, which include everything that we said, whether it was general safety, personal competence, good microbiological technique, PPE, various human factors or healthcare factors, emergency response and contingency plans should be ready, accident and incident reporting, facility physical requirements, equipment maintenance calibration and certification, disinfection and decontamination, transport, security. This entire risk assessment is the biorisk assessment or management system. Now, coming another important aspect, occupational aspect, is that healthcare workers should be immunized. And hepatitis B vaccine, if you have not taken it, please do it. 3 doses, day 0, 1 month, and 6 months. And if you are doubtful, complete the course of vaccination. Now, most laboratories have a facility of doing anti-HBs titers. So please get it done and see what your titers are and if you need to repeat the vaccination. Now, we spoke so many things. Just the last thing. What do you think? Safety and quality are equivalent? So, what do you think? So, safety is lack of harm, whereas quality is efficient, effective, purposeful care that gets the job done at right time. Safety is avoiding bad events, and quality is doing things well. Safety is less likely that mistakes happen, whereas quality raises the ceiling so that overall care experience is a better one. So they are two different things, but both are interlinked and they facilitate improvement in each other. If you're safe, you will produce quality. When you're producing quality, automatically you take care of safety. So, and I think hand washing cannot be overemphasized. That is the procedure which protects us. So, words of wisdom of hand washing are soap, water, and common sense are the best antiseptics. So, this is by William Osler, 12th July 1849 to 29th December 1919. Why did I read it? You know, we are now in 21st century. And when these things have been spoken in 18th century, we still fail to follow them. So please follow the basic steps of hand hygiene. Don't just put your hands under the water and take it out. Follow, and that is why we frame this mnemonic of Suman. Wash your hands properly. Seedha, hath, ulta, mutti, angutha, nakhun, and properly scrub them, and wash them with water, and then dry them. Wet hands would be a problem. So thank you so much. And this is, very, very full of gratitude for you people to have that much of patience. I will take any questions. You're welcome to come to our laboratories and see how we follow the biosafety practices. Thank you so much. Over to you, Dr. Sonal. If there are any questions, I'll be able to take them.
Yeah, thank you, ma'am. Thank you so much. It was a very interesting and a very basic topic explained in a very simple manner, and I'm sure everybody's gained a lot. So, in case there are any questions, you can either unmute yourself or put it in the chat box. When it comes to bio risk, what all measures should we take? I think it was there in your slides, but just over to you, ma'am, for this.
Come again. I am not able to see. What is the question?
Uh, when it comes to bio risk, what all measures are there to take? What do we take?
Yes. So, as I said, biorisk assessment is your responsibility. And the measures that you have to take is identify the risks when you are performing the activity and then think of means and ways to mitigate that. How do you do it? You have to do dummy exercises to see. For example, you're transporting sample from one place to another. Do that dummy exercise, see what are the hindrances that are coming, identify those risks. What could be the risks? That when you're transporting the sample from one door to the other, the door is tightly closed. So you have to push the door. While you're pushing the door, you may spill the samples. So for mitigation, you have to see that you're either not using the door, or you're asking someone to open the door for you. So this is very, very tricky. It has a whole science behind it to assess the risk and mitigate it accordingly. Similarly, when we are handling pathogens in the laboratory, if you are doubtful about whether you don't know what organism you're dealing, take the highest precaution. Like what we did in COVID. We didn't know how this virus spreads initially. And if you remember, we were all wearing the complete jumpsuits with face shields, with N95 mask, covering the face properly. And slowly, as we assessed the risk, we learnt about the virus, we stepped down the PP. Now you don't need to wear that complete jumpsuit. You only need an N95 mask if you're seeing a COVID patient. So risk assessment is done by practice, done by learning the techniques and knowing the virulence of the organisms.
Ma'am, another question is that are there only viruses in risk group 4 organisms?
No, they can be now Candida or risk group 4 usually are viruses, yes, but there are some bacteria that can fall in. And but as of now, as per WHO classification, they are mainly viruses like Crimean Congo hemorrhagic fever, Ebola, Marburg, newer viruses that are coming up all fall in risk group 4. Another thing that I want to tell you is that some of these agents may not be, depending on the pathogenicity and endemicity of the virus. Like, say, Crimean Congo hemorrhagic fever. When we take in our neighboring countries like Afghanistan and all, they categorize it at risk group 3, not as risk group 4s. Why? Because it is endemic. They are dealing it day in and day out. So as soon as they see an outbreak, they make their mitigation efforts, especially the first and second layers, and they categorize it into category 3 and work in it. Otherwise, they will not be able to work in cat. They don't have that many BSL4 facilities. So this categorization is also based on your endemicity of the disease. And mostly they are viruses, yes.
Another question is that uh, there was no Penicillium marnifi in any risk group organism. Is it not a risk group? Matlab?
It comes in, I think, risk group 2.
Hmm. Another question is the concept of small and large scale is no longer applicable. For spill management, which guidelines do we follow? WHO's biosafety manual or anything else?
So we have national guidelines where we address this, and both small and big spills. And you're absolutely right. All spills have to be handled in a way, and these are handled in a written in a national guidelines. Why do we say small and big spill? Is because, just to simplify. Otherwise, the procedure is absolutely the same, right? The contact time is
Right.
same. You have to cover it properly, and we have addressed this in our national guidelines. So those are in on NCDC website. Kindly check those. It is beautifully described there.
I think the
Any
last
other?
question. Thank you so much, ma'am, for taking all these queries and for the excellent lecture. Thank you, ma'am. So,
Thank you
with
so much.
that,
My pleasure. I hope, I love taking these, especially this particular talk, personally, not virtually, because there's so much to show. There's so much
so
we, you know. So, but anyways, I enjoyed, and I hope it benefited others who were listening to this. And this is like 2.5 days work that we've compressed into 1 hour 10 minutes. So,
mhm.
I tried to touch all aspects, but definitely, if you do it in a longer period, then we can explain things better. We do risk assessments when we are doing such exercises, in our laboratory, when we are training people in this thing. So it would be fun if some of you can come and join us when we are doing these trainings. We do all these things practically and show you.
Okay,
So
thank you, ma'am. Thank
thank
you.
you
I think
so
our
much.
students
Thank you.
went last time and they had full praise for your workshop, which they attended during Microcon. Many of our students had gone. So I'm sure others will also join us next time. Probably we'll do it under Delhi chapter this year.
Oh,
And
great.
some of them can join us.
Yeah.
So thank you everybody. And on 30th, we have another interesting topic on microscopy. So do join us on 30th of January, which Dr. Sunita Sahu will be taking. Thank you once again, ma'am.
Thank you. Thank you so much. And have a wonderful, wonderful evening, everyone.